Obviously, having a loved one, either a family member or friend who is diagnosed with cancer is a very life-changing moment. It can involve a lot of turmoil. The first thing is just to be with that other person, to be with the person you're caring for, to put the arm around them, to give them space, give them time to express their concerns, their anguish, their questions, just to listen and to be present in the first case.
I would say just take your time and breathe. Because initially when there is a cancer diagnosis, you may not have all the information at hand, so things may still change. It's carers and patients are often very worried, very nervous, and they would like to know everything straight away. And I would say just take your time, be patient, and sometimes the plan will still evolve and change.
As well as being a stressful crisis time for people, it's very difficult to try and maintain and take on all the information that they're given by the health professionals. And I think as well as that, they're also getting lots of information from well-wishing people in their communities, be it in their family, in their workplace, or in the social gatherings that they have. And what I often say to people at the very start is, think about what lens you want to look at your cancer and your cancer life through, and choose one that's an evidence-based, like the Peter MacCallum Cancer Centre, the Cancer Councils Australia, Victoria if they live in Victoria, wherever they live, and use that as a starting point to navigate the highway of the cancer journey they're beginning.
The Cancer Council is quite good in assisting with carer support and can help carers understand the diagnosis of the patient or their loved one. They can talk to their GPs, which most people have quite a good rapport with their GP, or the GP nurses as well that work within the clinic. They can guide them to give them handouts, provide them websites and phone numbers into where to look for these resources. My sort of experience is just for carers to also take time out for themselves. A lot of carers put their own needs aside and don't do the things that they want to do because they feel guilty, because they're meant to be caring for the patient. However, their mental well-being is also just as important as the patient's well-being. So to help provide the best care that they can for the patient as well as themselves. So.